Good day. Today, let's discuss the chapter 2 of your health education book. This chapter talks about the history of health education as an emerging profession. So, we all know that health education talks about those healthcare professionals who give education, who give knowledge towards to the community, to their family, to their colleagues, and to their friends as well. So it's a matter of educating them what is right and what is wrong. So what is health education? So health education is a process concerned with designing, implementing, and evaluating educational programs that enable families, groups, organizations, and communities to play active roles in achieving, protecting, and sustaining health. So this is the whole definition of what is health education. So, what is the purpose of health education? So, the primary purpose is to contribute to health and well being by promoting lifestyle. So, how can you promote lifestyle? Of course, by a matter of health education. Community actions that make it possible to live healthy lives. So, we as a healthcare professionals, we as a nurses, are the primary giver of information towards to our constituents. Okay. Discipline. So, discipline is a branch of knowledge or instruction. While profession, so di ba murag na ay similarity ang atong discussion sa fundamentals of nursing. So, parang naa siya same og definition. Profession defined as an occupation. Being a nurse, being a teacher, being an engineer, or whatever, being a doctor is your profession. Okay. What are the characteristics of profession? It is according to Upton. So, health promotion and maintenance are essential social service. So, this is the characteristics of profession. Require extensive period of preparation, like us, Bachelor of Science in Nursing, we need BS degree. At the same time, master's degree if you want to widen your scope of practice. Have the theoretical base underlying practice. It means that although you are practicing as a nurse in a hospital or whatever setting you are in, you have to make sure that you have that base academically. You have that theory that was being taught to you way back then when you were college. So have a system of internal controls that tend to regulate the behavior of its members. Number five, characteristic, have a culture peculiar to the profession. When I say peculiar, distinct or something unique to the particular profession. Number six, the importance of the work of health educator has to be recognized by most of community. So it has to be reciprocated by respect, of course, by importance sa tao sa community. Kasi pangit man po no, for example, you're a healthcare worker, nurse in the barrio ka, and then you give health education about the purpose of immunization, the importance of prenatal care, and so on and so forth, pero dili nila ma-appreciate. So, as a healthcare provider or as a healthcare educator, di ba parang you feel down. So, your effort must be reciprocated every time with respect and of course, ano po, na po positive feedback from the people in the community. Number seven, the last one, have an association, sorry. It is association that is representative of all that and can speak on behalf of all members. So, in every community, guys, naadyan na siya mga association or organization that actually help the people in the community. So, parang isa ka representative mo na siya ang mag-speak in behalf of the other members. So, what are the principles of education? So, according to Hobley, 1983, stated that health education is an essential component its aim of any program to improve the health of a community. So that is why guys, when mag second year college mo na amoy community immersion, pasabot ana is mag duty mo sa community, asa inyuhang you will be selecting a particular area of a community wherein you are going to cite the problems in the community, and then you will going to try to assess the possible solution for that specific problems that you've encountered in the community. So, mauna nyo himuon pohon pag mag second year na mo. Hopefully, this pandemic disease will slow down or somehow stop it siya, as in stop siya o transmit, so that you will enjoy your nursing journey, as student nurse journey sa Matidok. So, major rules are the following. So, what are the major rules of being a health educator or doing a health education? Of course, good health practices, sanitation, good hygiene, oral rehydration. So usually guys, pag ma-immerse mo sa community or even in your own community, the most common problem or sanitation, di ba? One of what the problems, sanitation, hygiene, di ba? Then oral rehydration. There are actually pediatric cases guys na they will suffer from dehydration that may lead to shock and then may lead to death. So that is why if naantay mga silingan dira nga ang bata or even adults who are suffering from diarrhea or loose bowel movement and other things like vomiting paired with LBM, you really have to encourage them to seek help from the doctor, seek help from healthcare professionals, because that scenario may lead to dehydration, that may lead to shock, and then may lead to death, of course. So, use of preventive measures, immunization, screening, antenatal, and child health clinics. That is why, guys, kung mapansin mo sa kada barangay, naagi nurse, di ba? So, the nurse in the barangay will represent or will give quality care towards the people in the barrio. They will immunize, di ba? They will perform immunization para sa mga newborn. They will perform prenatal care for those pregnant mothers, and then antenatal and child health clinics. So if in case sa mga bata na yung mga minor problems or mild symptoms, or yeah, that's it, and then they are the one who will going to help the patient. Correct usage of medication. So in our barangay guys, napo na siya ka ng TB, especially no sa city. I think sa city, for example, if you're living in East Coast, if you're belong from Caraga, I think sa city gyud, no, sa city dili siya sa city, sa kumbaga rural unit, na specific na TB facility kanang for TB medication. Kasi guys, pag you are positive sa TB, you need to be medicated for at least 6 months. So that is why reinforcement and proper instruction must be given to the patient who will going to take the meds. Kasi pag mas stop ng 6 months, for example, kay wala siya na tarong instruct and all, kung mas stop ng 6 months na possibility mag-relapse ang TB. So pasabot and paghatag nga meds, di na siya motalab sa isa ka patient. So another meds, another form of treatment na po mas mudugay. So that is why we, as a healthcare professional, we will have to make sure that we give proper information and with follow-ups and reinforcement as well. And early recognition of symptoms and promoting early referral. So, mo ginatrabaho sa mga nurses. Specifically, ako na-encounter usually problem sa barangay. Those pregnant mothers who are suffering from high blood pressure, they usually given prompt referral to the higher facility. Like mga tagas na BP, di ba? They are not allowed to deliver the baby in Caraga hospital, for example. Those mother who are primary, pasabot na first pregnant mother, and those pregnant mothers who are suffering from complications like high blood pressure and any diabetes or any other problem. So they are not allowed to deliver the baby, so they have to refer it to the higher medical facility. And then community support for primary health care. Okay. health education planning should consider the following decisions. So once you perform planning, guys, you really have to consider this following. So the first one you have to take into consideration is what is the desired change. If you're, for example, you are immersed in a community, pag-abot nimo dito upon assessment, upon proper survey or proper looking into the actual surroundings of the patient, of the people in the community, you will going to picture out what is the desired change. So the next one is where should health education takes place. So not just specific the place wherein you will conduct lectures, you will conduct like role playing, for example, you will conduct you will give information to them. So not just specific place, then who should carry it, and then how should it be done. So there are process in how health educators could facilitate the information so that the specific information should be absorbed by the said people in the community. Okay, so what to change? So there are steps, guys, on how you will going to change. The first one is you have to identify key problems, advices that should be given. So you identify, at the same time you give advices to the constituents, to the people living in the community. And then proposal for change, of course, as a nurse in the barrio, for example, ako a nurse, I couldn't actually propose a change and then apply it or implement it right away. I have higher ups, I have my I have my supervisor. So you really have to make sure na ang proposal nako is maabot sa ila. So simple to put it into practice. Of course, kung saan maging effective ang isa ka, change if dili na siya ma-incorporate sa daily practice ng mga taon. Fit with an existing lifestyle of the people. Of course, kung pobre ang naadid to kanang kuon kahimtang, i-adjust po ng imong plan in accordance with their lifestyle. Not require big amount of money and materials, of course, because they are belong to the marginalized sectors of the community. You have to make sure that their sources, your materials are actually kumbaga cost efficient. And at the same time, it meet a felt need of the community. It means importante gid na siya nga ma-solve. Kana gid imong nakita nga main problem sa community. Then, convey real benefits in the short term. Of course, makita ang benefits ana in short term lang. Dili to mga long term plans dapat. Now, for your activity, that is why you really have to watch this lecture, because I doubt nga dili good siguro na ginatan ang lecture. So I make sure that in the middle part of the lecture, dito na ako incorporate ang mga activity for today, so that kung dili ka magdanog lecture, dili jud nimo mabalaan na nade activity. Okay? So your practice for today, this would be your activity. Create a health education plan. Okay, you have to create health education plan. Problem or problems must come from your own community. Kung asa mo nagpuyo ron as what can you observe in your community, make a proposal for change and make sure you follow the principles. So we've discussed already the principles. You make a proposal for change. Like I'm your supervisor, I'm your higher ups, so you have to propose something for me about what do you think is the very important change that needs to be established in your community. Submit your output on or before 2 p.m. today. So this would be the email nga din yung isend ha, sanchezluel96@gmail.com. And then you have to finish the lecture, of course. So okay, this is your activity for today. Next, where to conduct health education. So, it can be done in a privacy of patient's room. Of course, kung nurse ka, naa ka sa hospital setting, pwede ka mag-educate sa patient. Like, for your patient is, galing siya, for example, post-op care. And then, you've noticed the patient was actually 12 hours post-op, pero wala siya nag-mobilize. It means wala siya takilid-takilid. So, you give education to that patient. You told the patient na, ma'am, you really need to turn side to side. because that will facilitate um, the facilitate of your metabolism, or the digestion. So that will also lead to your healthy like healthy diet. Like for example, ang imong patient is o siya naglihok-lihok, syempre after post-op operation, mga operation, usually ginamanipulate ang mga digestive organs like intestine. So, ginamanipulate na sa doctor. So, usually, if dili siya mag-turn side to side, that may lead to a problem. Like, pwede mag-lead o gas formation. At the same time, the patient is actually prone to pneumonia kasi basa iyang likod. So, that might complicate to other problem. And then, at the same time, ilang diet, dili dayon ma-resume. It's because wala man nagpabalik pa iyahang digestive process. So, you really have to educate your patient well. Kasi kung di nila maintindihan, di talaga nila gagawin. So, you will have to make sure that they understand it wisely and appropriately. Then, you can also conduct health education together with the family. You can conduct OPDs or outpatient departments, clinics, health centers, which applicable sa atong barangay because we do have a respective nurse in each center. Community barangay hall with different organized group of members, marketplaces, church, and community centers. So that is why this called that education for all. So para sa tanan ang education as long as that person can process the data, pwede nimo na siya ma-educate. Who should do health education? Kinsa man gina sila. So all health workers are responsible in instituting preventive aspect of care. But nurses, remember, is the primary agent for conducting health education to the patient, family, community members, student nurses, organized groups, school children, and anybody who is in need of information and instruction. So although the nursing attendants and other healthcare professionals are able to give health education, but nurses are the primary agent for that. So remember that, guys. So how should health education can be conducted? So there are actually, I think there are 4 ways on how you conduct health education. First one would be demonstration. It means doing a procedure is shown and the skills per techniques are practiced. Example, proper latching or breastfeeding. So, while nagakanda ka o ka ng lecture na ay mga imong target population is mga lactating mothers. So, nasa imong front and then you really have to perform the demonstration, the skills and the techniques you are trying to transmit it to the mothers. So, patuluan nimo sila unsaan pag proper latching, unsaon ang proper holding sa baby towards to the mother's breast. Another thing is, for example, your target population is adolescent stage like women and men sa mga adolescent. So you are performing on how to insert a condom. So syempre nagmodel ka og kanang saging and then how to insert condom because we actually do it when you go to community. Kung mag second year college mo, mag community mo, and it's part of the teaching on how to insert condom. Kasi nga guys, we are it's one of the effective or the best way to prevent sexually transmitted infection. At the same time, can prevent pregnancy as well. Although it's not 100%. Okay, so you can do it, like perform how to insert that one. There are other procedures that you can present to the mother. So it's up to you on how you are going to do it. But such is the set of examples. Next would be word of mouth. Word of mouth, puppet shows, dramatization, role-playing, or storytelling. So, yan. Mag-storytelling ka, yes. For example, a patient coming from that barangay who went to the health center, and then it's kind of late because the baby was already dehydrated, so there are already extreme symptoms like sunken eyeball, pallor skin, and other severe symptoms. So the baby died along the transportation to the higher facility. So it's just like a storytelling that you give information to the people of the community at the same time giving them lessons. The third one would be use of audiovisual aids, so leaflets, charts, poster, and flashcards. The use of comics can be very effective medium of instruction. And then another one would be film showing. Modular instruction is also effective. Learner use a sense of sight, hearing, taste, and smell. Now, this would be your activity number 2. You have to submit a video presentation. So remember, this would be your activity number 2. Submit a video presentation showing that you are conducting health education to the people in your community. You can choose either demonstration or word of mouth. Minimum of 3 minutes, maximum of 5 minutes. Attach your presentation to our Google Classroom link or file. So if you have YouTube, guys, you can download your video on your YouTube, and then you can try to copy the link to your Google Classroom and then send it to me. Or if naapa may mahuna-hunaan kung saan na siya pag-attach, you can do it as long as you can pass it on time. Deadline of submission, guys, is January 29 on or before 5 p.m. So 5 p.m. ha? So don't forget your activity number 2. So we will going to continue the lecture. Next would be the characteristics of effective health education. Of course, should be directed at the people in the community. Lessons are repeated and reinforced over time. So it doesn't mean na na-lecture na mo siya today, lain na po ugma, and other lain na po. No, you really have to make sure, allocate time for repeated lectures. Like, reinforce every time and every now and then so that ma-absorb yun sa mga tao. Lessons are adaptable using song, drama, and etc. So it means ka nang makatch nila imong attention. Training attracts the community's attention. Clear and simple language. Of course, lahi pod kaayo no kung dito ka sa community ninyo, mga mandayan tao. So, mag-English English ka dito, di gid sila makasabot sa imong point. So, you have to nimo siya, i-match nimo kung unsa ra ang capacity sa tao sa imong community. Short-term benefits of action are emphasized, of course, then provides opportunities for discussion and feedback. So you provide question and answer portion for them to for you to assess as well if nasabtan gud nila imong point. Next would be relationship between health education and health promotion. Primary role of health educators is to develop appropriate and effective health education through planning, implementing, and evaluating health plans and programs. So every like if you are in the community, like after a month or after 3 months perhaps, you will be given an evaluation papers for you to reassess or review your job at the previous month. Steps in developing a health education promotion program. You have to assess the needs of the target population, develop appropriate goals and objectives. This is very important because your goals and objectives would be the basis for during your evaluation. Creating an intervention that consider the peculiarities of the setting. It means you create, you innovate, because nursing is an art. You try to innovate coming from your resources, and you have to consider the distinct qualities of that specific setting, that specific community, that specific target, that specific group of people. Then you implement and then you evaluate the result. Now, there are emerging trends in the healthcare in America. We have to incorporate it because we are using US books base. Okay, so patients are discharged quicker and earlier. So in America, guys, patients are discharged quicker and earlier because there are new healthcare economics and advances in medical technology. So the downside here, that patients and their families have been burdened with responsibility of continuing regimen. So for example, ma-admit ilang pa siya ni 2 days. So syempre na mga continuing medication. So dili gyud na siya dayon makuan sa gets or dili kay na nila ma-incorporate sa ilang daily life. Maglisod sila. So that's why there is a reform made which called is managed care. So, managed care mo ang reform program nga na-formulate dito sa Amerika. So, the aim here is bridge the gap between the inpatient services and the community-based services. So, there is actually a referral here. When you are discharged, so this managed care, so when you are discharged in your community in the US, The community-based services is responsible for follow-ups and for reinforcement. And nurses have greater involvement in client teaching and self-care management, of course, discharge planning, because if you don't discharge the patient well, you don't give the enough information to that patient, that may lead to confusion and that may lead to um, non-therapeutic regimen or in compliance, diba? Dili na sila mag-comply sa ilang meds. And then, providing continuing care. So, you refer to these respective communities so that the community healthcare professionals will going to reinforce the teaching. And okay guys, that would be all. Please be mindful of your activities and make sure to submit in a timely manner. God bless guys and have a good day.